topographical model of MS, the way it was presented at the American Academy of Neurology here in 2015, was a series of videos, a series of moving rendered representations of this topographical model. The peaks emerging, the water level, which symbolizes functional reserve, declining. But those are really pulled from an app written for the iPad, which allows for really a detailed view of clinical course. And what we're trying to do is develop it in such a way that it won't just show archetypes, but could actually be used to show an individual patient's clinical course. And that's going to require people to use the app and enter their own patient's information, such as their relapses and their lesions and when those things occurred, into the app. And the app is made with an editor to allow that, and that's the thing that we're going to be developing over the coming months. So I'm excited for it because I think it's one thing to look at a model, it's another thing to try and use it in one's own clinical practice. And my hope is that it can affect the thinking about this disease. But I think it's also potentially useful as an educational tool, something that can help us teach patients what really is a relapse versus a bad day. What is a pseudo-exacerbation, and how is that different from a relapse? And what does progression look like? And be genuine about that with our patients. Because if we get away from trying to put a patient in a category, I think that we can speak to them in more detail about their own clinical course and help them understand it and what we're trying to do for them.